I think that a lot of patients would have no idea that a dermatologist deals with nail problems, and it's often something that they're really embarrassed about because the nails are on show, whether it's on your hands or on your feet if you're wearing thongs or slippers of some sort. It's something that a lot of people try to cover up, but there's actually a lot that can be done to help the nails. When a patient presents with problems with the nails, the most common things that I see are changes in the nail plate colour, often white or grey or even yellow discoloration, as well as crumbling off the nail plate and nail plate fragility. And this may be a sign of a nail fungal bed infection, and fungi are really common and they're really hard to kill. It probably affects up to 60% of the population at some point, so it's really important to have a good look at the nails to make sure that they're a light, healthy pink colour and that they look all the same. When you have a fungal nail infection, it can be quite slow growing because the nails actually take 9 to 12 months to grow out. So it might not be something that you see initially, but over time, the colour and the thickness of the nail plate can really be the telltale signs. So lifting off the nail plate from the nail bed may be a sign that there's actually some yeast that has got in under the nail plate. So yeast is just like a fungi, but it's an organism that can grow and prevent the nail plate from attaching to the nail bed. We see this really commonly in patients who tend to wash their hands a lot or do a lot of wet work. For example, gardeners or patients who need to wash their hands frequently for their job. Vertical ridging of the nail is actually really common and does happen as we get older. It's very genetically driven and may also relate to nail trauma. So simply hitting our nails over time, or if we have a very hands-on job, we tend to notice that the nail plate can get slightly damaged with time. There's not a whole lot that can be done about it, but the most important thing is it doesn't mean the nails are unhealthy. Certainly when I was growing up, Mum used to say, oh, the white spots on your nails means you need to drink more milk. Look, the truth is that certain mineral deficiencies such as zinc and calcium can cause white spots on the nails. Sometimes they appear for no reason and actually just disappear by themselves. So not necessarily a sign that someone isn't drinking enough milk or having enough cheese. By and large, the care of the fingernails and the toenails are fairly similar. There is a tendency, particularly more so for females than for males, to get their nails done by manicurists on a very regular basis and to actually push their cuticles back. But the cuticles are a really important protector of our skin and of our nails, and they form a really good seal to prevent bacteria, viruses, soaps and other harmful pathogens getting in and causing nail problems. So keeping our nails actually clean, short and not overdoing it is one of the most important things that I can tell my patients to do.